Hi everyone, I'll be talking about the most frequently performed surgical abortion method today. Greetings from Life Rule, my name is Johanna. So which one is that? It's called suction DNC, it's called vacuum aspiration, it's called suction abortion. There's lots of different names for it. It is performed between the 6th and the 11th week of pregnancy, up to the 13th week even. Let's just have a look at what the baby looks like at that age. This is a 12-week-old baby. So what does this little baby do? Of course, every organ, everything is present. It's practicing a lot of things inside the womb. It's practicing breathing by inhaling the amniotic fluid and has lots of hiccups. It's practicing sucking. It'll also have a preference already for left or right, depending whether it's a left or a right-handed little person. And it's jumping and swimming and moving a lot around, having a ball inside the womb. So this is the age up to which this so-called suction aspiration abortion can be done. Now, what is the method for this suction aspiration? What the abortionist will first of all do, he or she has to open the cervix to get the instruments inside the womb. For that, this kind of instrument will be used, which is a dilator. There are different sizes, and they'll start with a small one. The cervix, of course, at this time, the opening of the womb is tightly closed because we don't, the baby's supposed to stay inside. So they need to start with a small size and gradually open it more and more, increasing the size. After that, they will insert a tube. Now this is a manual suction aspiration instrument, aspirator, but usually you would have like a tube like this, a plastic tube, and then it's connected to a suction machine. This one you would have to manually do. It is used for abortions though. And as you can see, there's a hole inside here. So this would be inserted into the womb. There's a hole inside here. And then the baby is found through ultrasound and it's taken and sucked up into the tube here. And then this is discarded off. Afterwards, the womb would be cleaned. The lining of the uterus would be cleaned with this instrument, which is called a curette. And they just scrape the lining to clean it. So, what are the side effects that can happen with this kind of an abortion? First of all, there can be bleeding. There can be an incomplete abortion, which means when the baby is sucked, some pieces might remain inside. Now that can lead to an infection. Talking about infection, any part of the uterus can really get infected through this surgery, be it the fallopian tubes or the womb. And that can cause pelvic inflammatory disease, which in turn can lead to infertility. So the next time this woman who's had this pregnancy, who's had this abortion, wants to have a baby, she can't because she's infertile. Infertility can also come through this last step. Remember, they did this, the cleaning. So sometimes there can be a scarring on the lining of the uterus. And then because of these scarrings, sometimes women won't be able to conceive in the next pregnancy again. And also there can be great damage done to the cervix through this, these dilators that forcefully open the cervix. So that can also happen. And then in the next pregnancy, sometimes the cervix is not strong enough to be closed and it'll open too soon and you can have premature births, which is something that we deal with in India a lot. There are millions of babies every year that are born too soon. And some of it is because of cervical incompetence, where the cervix cannot hold the baby closed inside. Adding to that, these are physical possible side effects. Adding to that, there is a huge array of psychological consequences, ranging from depression to suicidal behavior, anything in between there, especially if you already have some kind of mental stress before the abortion. You need to watch our other videos that talk specifically about this. That can really be quite harmful for you if you're going to go through with this abortion. Okay, so know the facts before you make any decision. You deserve to know all the facts to make an informed decision that you can live with. Remember, this little one is hyperactive inside, getting excited about life. And the last important thing that we need to know is at this age, the baby can feel pain. So as the suction instrument is going in, it can literally feel the pain of being torn apart into pieces. Okay, thank you so much for watching. Please stay connected with us through YouTube, Instagram, and Facebook.